Treatment for borderline personality disorder, BPD, cognitive behavioral therapy, CBT. Cognitive behavioral therapy, CBT, is one of the most widely used and effective therapeutic approaches for treating borderline personality disorder, BPD. CBT focuses on identifying and changing negative thought patterns and behaviors that contribute to emotional distress, impulsivity, and interpersonal struggles, which are hallmark symptoms of BPD. Unlike other therapies, CBT works by helping individuals develop practical strategies for improving how they think, feel, and behave in response to emotional challenges. In this episode of the Borderline Personality Disorder, BPD, podcast, we will explore what CBT is, how it works for people with BPD, and the ways it can help individuals manage their symptoms and improve their quality of life. What is cognitive behavioral therapy, CBT? Cognitive behavioral therapy, CBT, is a structured, goal-oriented psychotherapy that focuses on the connection between thoughts, feelings, and behaviors. The premise of CBT is that our thoughts influence our emotions, and our emotions influence our behaviors. In the case of BPD, individuals often have distorted thought patterns that contribute to emotional dysregulation, impulsivity, and unstable relationships. CBT works by helping individuals recognize and change these distorted thoughts and behaviors to improve emotional stability and interpersonal functioning. How CBT works for BPD. CBT for BPD is adapted to address the specific symptoms and challenges of the disorder, including emotional instability, impulsivity, difficult relationships, and negative self-image. By focusing on the way individuals perceive situations and react to emotional triggers, CBT helps them develop more adaptive coping strategies and healthier ways of thinking. 1. Identifying negative thought patterns. One of the first steps in CBT is identifying negative thought patterns that contribute to emotional distress. Individuals with BPD often experience distorted thinking, such as black and white thinking, catastrophizing, or self-blame. For example, black and white thinking, seeing things as all good or all bad, with no middle ground. This often leads to idealizing someone one moment and devaluing them the next. Catastrophizing, believing that small mistakes or setbacks will lead to extreme, often catastrophic, consequences. For example, thinking that a minor disagreement with a friend means the end of the friendship. Self-blame, frequently blaming oneself for things that go wrong in relationships or life, leading to feelings of shame and worthlessness. CBT helps individuals recognize these distorted thought patterns and learn to replace them with more balanced, realistic thoughts. For example, someone might learn to recognize when they are engaging in black and white thinking and work to see a situation as more nuanced, acknowledging both positive and negative aspects. 2. Challenging and reframing negative thoughts. Once negative thought patterns are identified, CBT focuses on challenging and reframing those thoughts to be more accurate and balanced. For example, if an individual with BPD thinks, "If my partner doesn't call me back immediately, it means they don't care about me," CBT would help them reframe this thought by considering other possible explanations, such as their partner being busy or having an emergency. Thought records and cognitive restructuring are techniques used to help individuals examine the evidence for and against their negative thoughts, and come up with alternative, more adaptive ways of thinking. 3. Behavioral interventions. CBT for BPD also involves addressing maladaptive behaviors, which are often driven by emotional dysregulation and impulsivity. Impulsive behaviors, such as substance abuse, self-harm, or reckless actions, are often used as ways to cope with overwhelming emotions. In CBT, individuals learn to recognize the triggers for their impulsive behaviors and develop healthier coping strategies. For example, instead of engaging in self-harm when feeling rejected, a person might learn to use relaxation techniques or engage in a mindful activity like journaling to process their emotions. Behavioral experiments are used to test the outcomes of different behaviors and help individuals see that they can handle distress in healthier ways, reducing the need for impulsive or destructive actions. 4. Improving emotional regulation. Emotional dysregulation is one of the core symptoms of BPD. Individuals with BPD often experience intense emotions that seem uncontrollable and overwhelming. CBT helps individuals recognize the early signs of emotional escalation and develop skills to manage these emotions in healthier ways. Coping strategies such as deep breathing, progressive muscle relaxation, or mindfulness are taught to help individuals regulate emotions in the moment. Individuals also learn to accept their emotions without judgment, allowing them to experience emotions fully without letting them control their behavior. 5. Improving interpersonal skills. Relationships are often unstable and turbulent for individuals with BPD. They may experience difficulty maintaining boundaries, idealize others one moment, and then devalue them the next. In CBT, individuals work to improve interpersonal skills by setting healthy boundaries, learning how to say no when needed and establish respectful limits in relationships, developing communication skills, learning how to express needs and feelings in a constructive way, without resorting to aggression or withdrawal, addressing fears of abandonment, recognizing that emotional pain in relationships doesn't always mean rejection and learning to tolerate discomfort without resorting to destructive behaviors. 6. Building self-esteem. Many individuals with BPD struggle with low self-esteem and a fragile sense of self. In CBT, a significant focus is placed on helping individuals build a healthier self-image by challenging negative beliefs about themselves and learning to recognize their strengths and worth. Self-affirmation exercises help individuals focus on their positive qualities and achievements, counteracting the negative self-talk that often dominates. Self-compassion is encouraged, allowing individuals to treat themselves with the same kindness and understanding that they would offer a friend in distress. The benefits of CBT for BPD. CBT offers several key benefits for individuals with BPD, helping them develop more stable emotions, healthier relationships, and improved coping mechanisms. Some of the major benefits include: 1. Reduction in self-destructive behaviors. CBT helps individuals recognize the triggers for impulsive and self-destructive behaviors, such as self-harm or substance abuse, and replace them with healthier coping strategies. 2. Improved emotional regulation. By helping individuals identify and challenge their emotional responses, CBT empowers them to manage intense emotions and reduce emotional reactivity. 3. Enhanced interpersonal skills. CBT helps individuals develop more stable and balanced relationships by teaching them how to communicate effectively, manage conflicts, and set healthy boundaries. 4. Better self-esteem. Through cognitive restructuring and self-affirmation exercises, CBT helps individuals improve their self-image and learn to accept themselves as they are. 5. Long-term stability. CBT equips individuals with the tools to manage distressing emotions and thoughts in a healthy way, leading to lasting changes in behavior and emotional stability. Conclusion. Cognitive behavioral therapy, CBT, is a highly effective treatment for borderline personality disorder, BPD, offering individuals the tools they need to manage intense emotions, improve relationships, and reduce impulsive behaviors. By focusing on changing negative thought patterns and developing healthier coping strategies, CBT helps individuals with BPD create more stability, self-compassion, and emotional resilience. It complements other treatments, such as dialectical behavior therapy, DBT, and can significantly improve the quality of life for those struggling with BPD. In future episodes, we will continue to explore additional treatment options for BPD, including medications and psychodynamic therapy, and how they can work alongside CBT to help individuals with BPD lead fulfilling, balanced lives. Stay tuned for more insights on borderline personality disorder and its treatment.